The term I have for this, because it is an umbrella of lots of different things which can affect it and it can present in people, would be chronic vestibular spectrum disorder. As I've been in practice, the diagnoses have actually changed. So one of the diagnoses changed to what we now would call PPPD, so it's more about perceptual positional vertigo. But I realized between that, so PPPD, cervicogenic dizziness, POTS, even Meniere's disease to an extent, they all have such a big crossover in terms of the symptoms and the ways that we test for them. Because for a few of those, there is no definitive cause. So when you think about a condition or a disease, you think about, say, as an example, one of the other conditions of the ear, it's called labyrinthitis. It's very specific, it's viral or bacterial, it will produce horrible vomiting and dizziness and vertigo for a patient. They know which medication to give, and that's the fix. We know exactly what causes it. For a lot of those, there is no definitive cause. There's no what we call a gold standard. A gold standard is a way that you can do a test that says, yes, this is definitely this. A lot of them are really what we would call syndromes. And that's what a lot of these were, because really for, again, at least 4 or 5 conditions, if you put them together, you could use the same kind of treatments, the same kind of tests, and you get exactly the same results.
Wow.
So between cervicogenic particularly and say PPPD, for both of them, you could say if you turn your head, you're going to feel dizzy. But then how do you tell really which one is which?
Okay.
And also by having a label, sometimes it's a bit confusing for patients because they'll go to see a GP, an ENT, and a neurologist. They'll get 3 diagnoses, and then they'll be very, very confused. They won't know what to do. And so the next step for them is really, it's not about the label, it's how do I deal with this?
Yeah.
And that's really what the spectrum is supposed to be looking at, more of how do you deal with it, not just trying to give someone a label that then they're told to live with, which isn't very helpful for them.